Singapore has seen stroke cases increase over the past 5 years. Last year, there were more than 6,500 stroke victims above the age of 15. Now, that's about 14% higher than the number reported in 2009. And as our population ages, the number of stroke patients is expected to rise. And worse still, many are unable to go for therapy for various reasons. Now, this week, Vimita Mohandas puts the spotlight on how technology can help them.
Eight-year-old Madam Doris Zen, a mother of 3, once lived an active life juggling her work and family commitments and exercising daily. That was until she suffered a stroke in March this year.
After I had a stroke, I cannot go to work. I had to quit my job. Cannot do my household work. I cannot go my daily exercise. And cannot go out with my friends. I felt very sad. It's just at the end of my work. Cannot go out on my own. I cannot go shopping, cannot go karaoke.
After being discharged from the Singapore General Hospital, she was recommended to sign up for tele-rehabilitation. It's a low-cost program that uses real-time video conferencing, allowing therapists to treat and communicate with patients in the comfort of their own homes. The program is a result of a collaboration between the Singapore Millennium Foundation, the National University Hospital, Singapore General Hospital and Ang Mo Kio Tai Hwa Kwan Hospital. Patients do exercises prescribed by therapists by following videos they can view on their iPads. Sensors are attached to the patient which transmit data and their progress via Bluetooth to the iPad. Therapists can find out if their patients are doing their exercises correctly and inform them if they're not. They can also check for anomalies using the data or watch recordings of the exercise.
Right now, most of the tele-rehabilitation is actually done using video conferencing. So if you do it via video conferencing, what the therapist at the other side will only see an image. But it's difficult for them to understand, like, for example, if I raise my hand, what is the angle? So what we have done is we have developed some wearable wireless devices. So when you raise your hand, we are able to measure how high you have raised your hand in terms of angles and how long you have actually sustained that particular angle.
And this has certainly benefited Doris.
After the 12 weeks of assessment, we realize now Doris is able to move around even without any assistive devices like a walking stick or a wheelchair or a walking frame. Her range of motion over her left hand and her left leg has improved much. She's able to walk even without any help from anybody.
The idea of the tele-rehabilitation system was mooted 5 years ago, and based on studies that the team had done over 2 years, it found that stroke patients who returned for rehabilitation had better and faster recovery. Unfortunately, only 1/3 of them returned for rehab, and the majority of them who usually had disabilities said they found it difficult to travel from their homes to a day rehab center. So making care convenient for these patients was one of the main objectives when coming up with the system. Currently, some 18 patients have benefited from the system, and researchers hope to extend this trial to 50 patients in the next 2 years.
The tele-rehab system can actually help provide patients who are stuck at home, because patients who have disability and who need rehabilitation typically tend to be homebound. Whether we can use the system to provide them supervised therapy remotely with maybe a caregiver or maybe with a therapy aide who visits them maybe about once every 2 weeks or periodically.
For therapists, this means cutting traveling time to and from patients' homes, allowing them to treat more patients. And this is important as the number of therapists hasn't kept pace with the rising number of stroke patients.